This lesson is on the lymphatic system. The lymphatic system consists of three parts: the lymphatic vessels, the lymph, which is the juice, and the lymph nodes, which filter lymph. The functions of the lymphatic system to return and leaked plasma proteins back into the bloodstream. If the interstitial fluid enters the lymphatics, it becomes lymph. And together with the lymphoid organs and tissues, the lymphatic system is the structural basis of the immune system. And you can see we have the same schematic that we had before with the heart and the veins, but we also have mixed in the lymphatic system. These represent lymph nodes filtering the lymph here. And over on this side, you can see how the capillaries are intertwined with the arteries and veins. So, the capillaries with the arterial and the venous side and the lymphatic side are all intertwined. And the venous side is designed to pick up spilled interstitial. Sometimes it misses some. The lymphatics is a backup system, and it has a very unique system. It picks up bigger particles as well. It has these filaments that are anchored into connective tissue that hold this lymphatic vessels open, and then little mini flap valves. So you get a one-way flow up into this lymphatic. And we have a one-way system that goes all the way from the tissue level, which is our lymphatic capillaries, and then those join to form collecting vessels, which join to form trunks, and then eventually ducts, and then the lymph is returned after being filtered and cleaned into the venous system. Lymphatic capillaries are very permeable, and they take up debris, pathogens, and cancer cells. You may have known someone who had breast cancer. They took out lymph nodes to see whether it's already spread, because it's known that if the breast cancer does spread, that's the first place it's going to spread, is to those lymph nodes. Lymphatic capillaries are absent from bones, teeth, marrow, and the central nervous system. Lacteals are specialized lymphatic capillaries in the intestine. They absorb digested fat, and it's called chyle, and deliver it to the blood. The fatty lymph is chyle. The blood vessels, the blood capillaries are a little too small. They don't really pick up the fat, so it will be delivered to the bloodstream through this chyle, or through the vessels. Okay, the lacteals. Okay, collecting vessels, similar to veins. So we have the capillaries have come together. These have got more valves, more internal veins, more anastomoses. Now, collecting vessels in the skin travel along with superficial veins. But if you ever see someone that has an injury to their hand and they've got red streaks following along beside their veins, those are infected or inflamed lymphatics, and those are indicating that that person is fighting an infection. Then they're going to swallow lymph node. If that's not treated, they could end up with that infection put into the bloodstream, and then they're septic. Deep vessels travel with arteries, and as the arteries beat, they thump against the lymphatic vessels. And since the lymphatic only can go in the direction opposite of the artery, it actually helps push the lymph forward. Now, nutrients are supplied to the lymphatics from branching vasa vasorum, which is tiny vessels that surround the lymphatics. Okay, the trunks, we have lumbar trunks, bronchomediastinal trunks, subclavian, jugular trunks, and a single intestinal trunk. Now, ducts, lymph is delivered into one of two large ducts. On the right side, the right lymphatic duct drains the upper arm and the right side of the head and thorax. The thoracic duct arises from a little structure called the cisterna chyli and drains the rest of the body. And then it enters the venous circulation at the internal jugular and subclavian veins at the junction on each side, on its own side of the body. So as you see, the green here on this side is all coming from the, is all draining into the right lymphatic duct. Now, the thoracic duct, which starts here, cisterna chyli, here, this big green blob here, drains all the rest of the body. Now, again, another asymmetry in the human body. And all these little blobs along here are lymph nodes. You see a lot of lymph nodes in the inguinal areas, here, elbow, axillary areas, along the throat. And these nodes filter the lymph. These deeper vessels, this is showing where the actual ducts dump into the circulation. So here is our subclavian vein here. I can't get it to work. There we go. The subclavian vein and the jugular. So right here is where the right lymphatic duct dumps its fluid. Left subclavian vein, left jugular. So right here is where the thoracic duct dumps its fluid. And you see how big this thoracic duct is. In the case of injury, in the case of cancer, this thoracic duct can break and then it will spill fluid out to surround the lungs and crush the lungs where they don't function properly. Okay, lymph transport. Lymph is transported by pulsation in nearby arteries, and then smooth muscle. There's a little smooth muscle in the walls of lymphatics, and then contraction of muscles, very much like in the venous system. And that's why if someone sits and does nothing all day, they not only get back up in their circulation of their bloodstream, but also in their lymphatics. Okay, lymphoid cells. The biggest deal cells are the lymphocytes. And we have two varieties, T lymphocytes and B lymphocytes. We call them T cells and B cells, but they're all lymphocytes. And they fight against antigens, which are bad guys. Anything that is foreign, does not have the name tag of the human or of the organism. If it does not have self markers, it's got to be foreign markers. Bacteria and their toxins, viruses, mismatched red blood cells, cancer cells, fungus, any of these are fought by lymphocytes. Now, T cells are the managerial system of the immune response and attack and destroy foreign cells as well, and we'll talk about them a little bit more. These mature in the thymus. That's why they're called T cells. T is for thymus. B cells produce plasma cells, which then secrete antibodies, and the B cells mature in the bone marrow. So B is for bone marrow, T is for thymus. There's other lymphoid cells. Macrophages are there to phagocytize foreign substances. They also alert T cells to the fact, the T lymphocytes, to the fact that there's something foreign there. Dendritic cells capture antigens and deliver them to lymph nodes. And then reticular cells actually make the stroma, which is the house that supports the other lymphoid organs. It builds the lymph node. Okay, lymphoid tissue is a place for lymphocytes to hang out, a good surveillance point for them. And we have two types: diffuse lymphatic tissue, lymphatic follicles. Okay, lymphoid tissue. We have lymphatic tissue throughout everything, everywhere, the reticular tissue elements, every part of the body. Large connections in the lamina propria of mucous membranes, lymphoid organs. Lymphatic follicles or nodules are solid spherical bodies of tightly packed reticular elements and cells. Now, lymph nodes. Now, you notice the word node. It's not a gland. In fact, if you write lymph gland, I think I'd count off 50 points because it's just so wrong. If your doctor says that to you, he's patronizing you. Either that or he's dumb. He's probably patronizing you. Okay, but they're not glands, they're lymph nodes. Now, these are the principal lymphoid organs of the body. They're embedded in connective tissue, they're in clusters along lymphatic vessels, and they're near the body surface, inguinal, axillary, and cervical regions of the body. So these green, all these little bumps are lymph nodes. Bump, 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 lymph nodes here, all these. And if you have a swollen lymph node, it indicates some sort of infection. Now, what they do is they filter the lymph, and macrophages destroy microorganisms and debris, cancer cells that are filtered out into the lymph. The immune system lymphocytes are activated to mount an attack against antigen. A lymph node is bean-shaped, as an external fibrous capsule. Trabeculae inside, it divides the node into compartments, and it has a cortex and a medulla. Okay, the cortex has a lot of B cells in it, and dendritic cells, and the deep cortexes. The deep cortex houses T cells, but they're generally in transit. They don't like to hang around, they like to move. B cells can set up shop in a lymph node and stay there forever, for your entire life. T cells circulate, move in and out here and there. Okay, if you're in Atlanta and you're in traffic and you have 1, 2, 3, 4, 5 lanes of traffic, and they suddenly come together and only have 2 outgoing lanes, you're going to get a traffic jam. Well, this lymph node is designed this way intentionally. These are afferent or incoming lymphatics coming into the lymph node. Efferent, E is for exit. This is outgoing. And it's deliberately set up so that you have more stuff coming in than going out. Causes stagnation within that lymph node. Gives the B cells and T cells time to notice that there's antigens there. Gives the macrophages time to eat those antigens. Medullary cords extend towards the cortex, have B cells, T cells, and plasma cells. The sinuses in lymph nodes have macrophages that eat things that need eating. So the lymph comes in through the afferent vessels, travels through these big sinuses, and exits through the efferent nodes, and it causes stagnation, just like I said, and allows those lymph nodes more time to function. Now, the spleen is the largest lymphoid organ. It's served by the splenic artery and vein, which enter and exit at the thallus. Now, and they are the site of lymphocyte proliferation. It also removes old blood cells, platelet, and debris. So it's very important for your immune system, though you can't live without a spleen. If the spleen ruptures, it's extremely vascular, and you can bleed to death. This is showing the splenic artery, but what it's not. It does show it branching off some, but if you're removing a spleen surgically, it's very difficult to get here and get this whole artery and the whole vein. Generally, and this one's pretty dead, so it's not going to bleed. But you generally have about, seems like 14 million of these vessels that you have to ligate to keep a patient from bleeding. Okay, what the spleen does: stores the breakdown products of red blood cells, such as the iron, for later use. Stores platelets in case you need some platelets later. This is where the fetus produces erythrocytes. It does have a fibrous capsule interbellate, has lymphocytes, macrophages, lots of erythrocytes. It is extremely vascular. It has two distinct areas, white pulp around central arteries, and it's white pulp because it has white blood cells, specifically a lot of lymphocytes. And then you have red pulp in the venous sinuses and splenic cords, and it's red because it has old red blood cells and pathogens that are being destroyed by macrophages. Now, this next picture looks more like a Mr. Potato Head than it looks like a spleen, but it still shows us that we have red pulp with red blood cells, white pulp with lymphocytes, but it really does look like a Mr. Potato Head. I should have pulled up a good spleen off the internet. I'll let you do that yourself. Okay, the thymus is a lymphatic organ that many people have never even heard of. In fact, if you've never heard of it, it's probably because yours never gave you any trouble. The size of it depends on your age. In infants, it's pretty large. I think we've got a picture in a few minutes. Over the inferior neck overlies the heart, increases in size, and very active in childhood as your immune system is developing. During adolescence, it stops growing and then it gradually atrophies so that adults and especially older people have very little thymus left. It has an outer cortex and an inner medulla. It's packed with lymphocytes and macrophages. The medulla has fewer lymphocytes and is involved in regulatory T cell development. Okay, this is showing what the thymus looks like. That's supposed to be a photomicrograph, but this is a picture of the actual thymus. Differs from other lymphoid organs in very many important ways. First off, it only functions in lymphocyte maturation. It does not fight antigens. Reminds me of a college teacher. We sit here and tell you how to do work without doing any work ourselves. Well, the thymus sits there and essentially matures, grows, trains, and selects through which lymphocytes, T lymphocytes, make the grade. Then when they're released, they can do their job. They have to become immunocompetent. Okay, tonsils are the next thing. We have palatine tonsils, lingual tonsils on your tongues, pharyngeal tonsils. These are your adenoids, and then tubal tonsils around the auditory tubes. Now, these contain follicles, germinal centers, but they're not fully encapsulated. They have crypts, and the crypts trap and destroy particulate matter. This is showing tonsillar crypt. Now, several of you have had issues, I'm sure, with your tonsils, tonsillitis. This is showing you the adenoid here, the palatine tonsil here, and then the lingual tonsils on the tongue. Okay, if you have trouble, insurance would pay to take your tonsils out if you just wanted them out. And it also didn't cost much of anything because it's not a very complex procedure. Now you have had, I think, 10 infections, most insurance companies, 10 tonsillitis infections documented within 6 months, which means you're staying at the doctor and never getting anywhere. Now, removing them routinely for no reason is not a good idea because they are an important part of your immune system. But if they are so large that they obstruct respiration, that's another reason you can remove them. If they're so large, they go if they're obstructing respiration. If they stay infected, they've got to go. Now, when loophole and there are 10 infections thing, if you get in these tonsillar crypts, if you get little particulate matter that's caught up, filled with pus, and then slide out, they call them tonsil stones. And you can recognize them by they're caught in these crypts. And then the person that has them, well, one, they have death breath, back bacteria breath, and the stones, they cough them out, and when they do, you get bleeding in this tonsil, and it's inspissated pus. It's white blood cells, bacteria, and dead white blood cells. That's what it is. It's just blood cells. It's just pus that's dried out, rotting flesh, bacteria, and white blood cells. But when you bleed, you actually inject bacteria into the bloodstream, and the kid may get a little bit of a fever, say just a few days after. They just spike a little fever, then it comes down. But this can happen over and over and over, and they're having low-level septicemia, and it can cause dysfunction. And this will, if you can get your doctor to write it up right, they will take your kid's tonsils out and pay for it. It's done generally as an outpatient procedure and is not that expensive. They usually take out the adenoids as well when they take out tonsils. Okay, aggregates of lymphatic follicles, Peyer's patches, little small follicles in the walls of the small intestines, a lot of these in the appendix. So the appendix actually does have some use. It's part of your immune system. And then Peyer's patches in the appendix are thought to generate memory lymphocytes. So if you have germs they've seen before, then they know them next time and can have a better response. Okay, and we discussed in class, when we think of MALT, we think anything but mucosa-associated lymphatic tissue. But this includes Peyer's patches, tonsils, appendix, lymphoid nodules in the wall of the respiratory tract, and they protect the digestive tract and the respiratory foreign material. And I believe that's the last slide, if I'm not mistaken. Yep, sure is. So we'll talk to you next time.